Hello, welcome to Health Talk. I'm Dr. Manny. It's most known for sparking romance around the holidays, but mistletoe has actually been used for thousands of years in medicine. Today, it's one of the most widely studied alternative therapies for cancer. Here to tell us more is our own medicine hunter, Chris Killam. Thank you for being here.
My pleasure.
Mistletoe.
Mistletoe.
I'm usually looking for somebody to kiss.
Right, like the kind of planning your entry into the doorway.
I carry one in my pocket usually in the holidays. And say, hey,
hold
look,
it over your head, right?
You know, let's kiss. But you say it's a very potent medicinal plant.
It's been used since the early Greeks and even the Druids as kind of a cure-all. It's one of those medicines that, you know, you'd go to the herbalist and whatever it was that you were sick with, they'd give you mistletoe, some sort of a preparation of mistletoe. And probably because it has significant immune-boosting properties. So if you're sick with recurring colds, if you're sick with, you know, some sort of disease or another, the odds are pretty good that if you'll take mistletoe and boost your production of protective white blood cells,
those T cells.
Yeah, the killer cells, the T cells, that'll stimulate more rapid recovery. So it really has been known historically as a cure-all remedy.
Do people take it prophylactic? In other words, do people take it like as a regular tea to prevent disease?
You know, I don't see mistletoe around as something that people take kind of as just sort of a health agent. I really don't see that. Mistletoe and its use for cancer.
Yeah, because in the intro I mentioned cancer.
Right. Well, the interest in that goes back to about the 1920s.
But is it being used in let's say I don't want to call it legitimate, but you know, in medical hospitals, or is it done?
Yes, it is. Not in the U.S.
Right.
But it actually, there are different extracts of mistletoe that are used in injectable form, especially in Europe. And it's kind of curious. Mistletoe grows on different trees. It's parasitic, so it's not like a freestanding bush itself. You'll see it like in the crook of branches in an apple tree or an oak tree or an elm or something. And there's some opinion that the mistletoe that grows on an apple tree, for example, will have somewhat different chemical properties than the mistletoe that grows on an elm. In any case, extracts of mistletoe are made by drug companies in Europe. Much of the science on cancer and mistletoe has been conducted in and published in Germany. For cancer treatment, it is given by injection, either under the skin, sometimes intravenously, sometimes directly into solid tumors. And here's what we know. In the laboratory, which is typical of many agents actually, mistletoe kills certain forms of cancer. In clinical trials, it seems to be helpful in cases of colon and rectal cancer. It is used as an adjuvant therapy, so in addition to other chemotherapeutic agents, it appears to lessen the severity of the symptoms of other chemotherapeutic agents that might make you quite sick, nauseous, lose your hair, etc. And in addition to that, it appears to cut off the blood supply to solid tumors, like the drug Avastin.
Right.
Okay, anti-angiogenesis. Angiogenesis, the blood supply to tumors keeps them fed. If you cut off that blood supply, the tumors die. Mistletoe appears to do that. FDA doesn't approve mistletoe, as it doesn't with many other therapeutic agents.
What about side effects?
The side effects seem to be limited to some cases of nausea, some cases of headache, nothing particularly serious. They're not that common, and it does appear that as an adjuvant therapy, it greatly boosts the production of immune factors in the body. It's very interesting how you have a number of natural chemotherapeutic agents like Crestin from mushrooms, mistletoe, that are used in other countries, in Europe, in Asia, but not approved here.
Now, do you think that there's going to be a trial or any kind of, movement towards applying it? I mean, there has
I
to
do not know. I think, honestly, Dr. Manny, I think it has to do with whether or not there's a patent position for a big drug company. Because if there isn't a patent position, then no, because the big bucks won't be there.
Right.
If there is a patent position somehow, if somebody can make a special extract of mistletoe or whatever, and there are billions potentially down the road,
then you
yes.
see the trials.
It's all going to be about the money.
It's all about the money.
It's not going to be about the
Anyway, I'm not going to look at Christmas with mistletoe anymore the same way. It was kind of...
You get kind of like a Christmassy tie going on here.
It had the sexy appeal to me. Now it has more of a serious... It's a serious herb. Serious.
I think you can still kiss under the mistletoe.
I'll kiss under. Thank you so much for being here. You're great. And be sure to check out the Medicine Hustlers articles every week on FoxNewsHealth.com. And if you have any health topics you want to talk about, email me here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.